So, today we have Tony Casina with us. Tony first walked through the doors at Thorndale Dental over 31 years ago. Welcome, Tony.
Well, thank you, and I'm happy to be here. One of the things I would share with you is that I've been coming to see Dr. DeForno for that 31 years, and what brought me in the door was actually my wife originally came to see Dr. DeForno and said, "Oh, I found us a new dentist," when we had moved here in Thorndale. So I came to see Dr. DeForno and immediately liked him and really enjoyed talking with him about my dental plan from a standpoint of what he would help me do with my dental health. I was a pretty good case for him because in my earlier years and younger years, the dental treatments were not as effective as they could be, and my chemistry of my mouth obviously didn't help with my dental health. Dr. DeForno then set me down a pathway of a dental plan that would address some of the issues that was going on in my dental health that he thought would make things much better for me from a health perspective.
Specifically,
also,
what were those, Tony?
well, I think, obviously, when you have issues around gum disease, which I had, he wanted to get that treated for me. I also, he said treating that gum disease avoids issues with bacterial infections, and also prevents potentially heart disease
Exactly,
from bacteria, in your system. So that was one of the areas that had to be treated. Of course, I had cavities, and those had to be treated, and old metal fillings or silver fillings that had to be removed and retreated because they were deteriorating and degrading in my mouth. And then I had some issues with an injury that occurred as a result of being in the gym. I had a tooth almost knocked out, which ultimately ended up being root canal a number of years before I saw Dr. DeForno, and had to be retreated in my years after getting out of college. They had to go back in and retreat that area where I had suffered that injury to my tooth. And then, of course, I had other issues where teeth had deteriorated to the point where Dr. DeForno said the only way to really save them would be to put crowns in certain positions in my mouth. So, in certain teeth in my mouth. So, we were able to go through that treatment as well, and obviously over time, I continued to come to Dr. DeForno. His staff is so great about making sure we, follow the dental health plan that he had laid out for me.
Which you did.
And yes, and make sure that I take care of my teeth routinely. And when I come to see them, they are very kind and helpful with explaining what the treatment is that's planned for that day, and ultimately into the future. Obviously, people are afraid of dentistry. Sometimes they're afraid of potential pain or something like that in the treatment. Dr. DeForno and his staff are always very careful to make sure that was comfortable throughout any treatments that they were going to do for that particular day. More recently, one of the areas that was treated as a result of a crown and a root canal had to be addressed more specifically because that tooth was becoming loose and we couldn't save the tooth specifically. So I had to think about what treatment I wanted to have done. I had a choice between implant or a bridge. And that bridge, could potentially have been something that I could have chosen versus an implant, but I insisted on the implant for a couple of reasons. One is that I didn't want to have to go through the bridge route and have that bridge connected to other teeth in my mouth, which potentially over the long term can have some damage to those teeth. And I thought that an implant would be a better choice in the treatment of my dental health from a standpoint of cosmetically as well. Plus, it wouldn't require as much care on my own at home. When you have a bridge, there's probably much more care that has to take place on the part of you as a person in taking care of that bridge area and making sure it stays clean and so forth. The choice of a implant involved some pre-treatment before we could actually do the implant. In my mouth, in that area that had to be treated, that tooth had poor bone underneath of it, so we had to rebuild the bone in that area. Now, on the first treatment that we went through, unfortunately, my mouth didn't respond to very well, my body didn't respond very well, and build the amount of bone that would be expected to be able to hold an implant. But we went on and did a secondary treatment that Dr. DeForno said that he had learned a few years ago about how he can improve the bone growth in that particular area with this treatment. So that we went through that treatment, and that stimulated bone growth in that area, and we were able to finally get to the end point of inserting a implant in that area. So it's been this last part of treatment has been a little bit of an odyssey from the standpoint that it took about 2 years to complete, but that was because of the way my body reacted to developing bone in that area and so forth. What I can tell you is that over the past 4 or 5 years before we actually went through this treatment, I was very careful about eating on that side of my mouth. So things like apples had to be cut up, or corn, or bread that's a little tough, when like Italian bread that eat at the restaurant and you pull in your mouth. I really didn't want to eat on that side of my mouth, so I was always forced to eat on the right side of my mouth. And during the time that we were doing the treatment for the implant and the bone growth, there was a temporary in that area on the left side, and I had to be careful about not crunching down on anything on that side. I did have one time where I actually bit into a piece of pizza and actually knocked the temporary out and had to come back for treatment, but that was my fault for not being careful.
So now?
Well, with the implant, I'm still a little cautious. It's been only a few months.
Takes a little bit of getting used to.
Yeah, and I still have a tendency to eat to the right side out of habit. And I'm still not confident yet about biting into an apple and assuming that the implant is going to hold. But that's, I think, more of a fear on my own part rather than the fact, or rather than there's anything wrong with the implant or anything that's going to be challenging with the implant. It's worked very nicely so far, and I feel very confident over time that my fear or trepidation about eating on that side as much will be less and less.
So you're gaining confidence and trust in how your mouth and your teeth are handling it now?
Absolutely. The challenge before I had the implant done was always avoiding that area and being conscientious about avoiding that area. And now I'm less inclined to be concerned about it because of the fact that I've had it in for a couple of months now, and it's been very easy from an eating perspective. I also think that when I had the temporary in, my speech was a little bit affected by that, and it seems to be much more clear and much more distinct
Right.
than in the past couple of years when I had the temp in. So.
Right. Well, that's so good to hear, Tony. So now today you were in for bite pain, for an appliance impressions to protect your teeth?
Well, absolutely. Dr. DeForno has suggested that I have something that will protect my teeth so that while I'm sleeping, there's no effect of grinding on those teeth. And so he's recommended this bite plane so that I can sleep comfortably, at the same token protect my teeth from any potential damage that I could do from grinding my teeth. And most people do, have some grinding of their teeth during their sleep time.
Exactly, and you want to protect all this dentistry you've just recently had.
Yes, it's, if anybody tells you that it's not an investment, it is an investment in your dental health. So I want to protect that over time, throughout the rest of my life. So.
Well, I'm so glad to hear that, Tony. Thank you so much for coming in, and I think we'll be seeing you again shortly for the final fittings for your appliance.
That's correct, and I'll be happy to come back and see how Dr. DeForno enjoyed his vacation.